It's certainly true that inflammatory bowel disease, which is Crohn's disease or ulcerative colitis, shares some similarities with psoriasis, for example. We know, as far as treatment goes, that both conditions, inflammatory bowel disease and psoriasis, both respond to TNF blockers. So a lot of these patients will come in with IBD already on infliximab, for example, an IV TNF blocker. When we see these patients with inflammatory bowel disease and they have psoriasis, sometimes it's nice to feed two birds with one stone. Not kill two birds with one stone. Why are we killing birds, right? But feed two birds with one stone by way of maybe starting an interleukin-23 inhibitor. So that's a phone call to the gastroenterologist to say, hey, look, I noticed that this patient is on maybe a TNF blocker right now for their inflammatory bowel disease. Maybe it's not adequately controlling their psoriasis, or maybe it's actually bringing out psoriasis, which we know can happen from TNF blockers when prescribed for a non-psoriasis reason. And so that phone call could be, can we start a medicine like guselkumab or risankizumab? These are now FDA approved for Crohn's disease and ulcerative colitis. So it's basically that phone call reaching out to the gastroenterologist to see if we can do both diseases with one agent.